So I've injured my knee. I've been told it's an ACL injury. What do I do next? Well, obviously I haven't injured my knee, but as a personal trainer, I have lots of clients that have. So today I'm going to be talking to a knee surgeon and a physiotherapist to find out exactly that. What exactly happens when the ACL tears?
When the ACL tears, the knee fills with blood, so you often get a huge swelling in the knee. The patient can't play the sport anymore. They have to get stretchered off the pitch. The knee's very painful, and sometimes they can even hear or feel a snap in the knee.
So the causes are multifaceted. How do we recognise an ACL tear when it happens?
It's a big injury to the knee. You'll know when you've injured your ACL. You'll be involved either in a collision or in a landing injury or in a pivoting movement. Your knee will suddenly give way. You may feel or hear a snap and the knee's really painful. The knee's swollen straight away and it's really difficult to play on.
From a physio's perspective, what are the challenges that most patients tend to face?
In the acute stage, it is the pain, the swelling and the instability. All three of those things can be a big issue initially. The biggest problem with the ACL injury is the length of time for the recovery and being patient with it. It's not something that's just going to get better in 6 weeks, regardless of whether it's a partial tear, a full rupture. It's a slow recovery. And I think patients often don't appreciate that at the start of the journey. When we're talking to them about 9 months, 12 months for a full recovery, they don't quite get it, but you need to be patient and then consistent with your rehab. Again, regardless of whether you have surgery or not, timescales for recovery are similar. So be patient, be consistent with the rehab. If the injury isn't sort of diagnosed and treated effectively, it can lead to longer term issues. So that instability puts patients at higher risk of falls or injuring other structures in the knee, cartilage, meniscus, other ligaments. And that's then going to have a big impact on quality of life. So even if you're not wanting to play sport, just being able to get around, work, do the things that you want to do, it can have a massive impact on that. So whether you have surgery or not, it's really important we address the problems so that you can make a full recovery.
So long term, what are the implications of an ACL tear?
When the ACL is torn, there is some instability in the knee. What that means is that as you continue to play sports or carry out demanding activities, the knee continues to be unstable, which risks injury to the cartilage and to the shock absorber in the knee. Longer term, there's a higher risk of injury to the cartilage and developing arthritis if the ACL is not reconstructed.
For prevention, what exercises can people be doing to reduce the risk of an ACL injury?
So you've got your traditional strengthening exercises that will work on sort of the general strength of the leg, but you need stability and balance exercises as well. So you need to be able to not only generate force, but to then absorb force. So those plyometric exercises are really key in achieving that to help minimise risk. If you're just doing strengthening, just pure basic strengthening, that's only part of it. You need the plyometric work as well.
So I've never heard, someone watched this video, I've never heard what plyometrics is. Can you quickly explain that to us, please?
It's basically impact exercises. So things like box jumps, single leg hops, things like that. So it's that absorption of force and then propelling off as well.
So now I know what I need to do when I have an ACL injury. For more information on ACLs, click the next video.